Should therapy be more regulated or less regulated? Mental health services, like all fields really, for the most part, have some sort of regulations. If it's not just standard laws that everyone abides by, it's specific things like contractors having to keep things up to code and health field in general having to maintain certain level of standards and compliance with quite a few different sets of standards actually federal law, state law, ethics codes, all these different things that HIPAA compliance, which is you just say law again, but there's a lot that goes on versus a wild west of input. And I think a really good point of discussion for this is there are quite a few therapists who also offer life coaching. What's the difference, you ask? For many, none. But life coaching doesn't have any regulations around it. Therapy does. So, now, granted, if you're doing clear therapy with life coaching, that is what we would call practicing without a license. So, even if you are licensed, but that's not what they agreed to be doing is therapy, you're practicing without a license per the agreements. So, um, I think it's a separate video on life coaching, which I'm not actually in any way against. I'm against people who are insufficient at therapy using that as a way to provide healthcare illegally. But in general, there's actually quite a few reasons why life coaching can be very useful or professional uh, coaching and things like that. So that's not the point of this video. The point is regulations and does it make sense to have them? I'm going to start by saying yes. From a political perspective, there's opinions on regulation. Should we have more or less? I'm going to really try not to be very political about it. I think maybe things I say you can pull into politics if you want. I'm going to focus more on what I think is overall best for the health and safety of clients. And that's ultimately the point, right? Like, we can talk about protecting business owners and employees. And at the end of the day, what we're trying to do is protect people. That's technically the point of laws and regulations. Now, there's definitely ones that are put into place um, that really don't have the people and their best interest in mind. And that's not my area of expertise, so I'm not going to dive into that. What I'm curious though is really where the line is, and I'll tell you up front. I'm not going to end this video. This is processing and thinking. I'm not going to end this video with this is the solution. This is what we should do. Perhaps though I can explain a little bit about my perspective on it. I do think it's good to have standards. What's interesting is that a lot of the standards for therapists are more of how they legally are tracking their client. Actually, a lot of it isn't around client care. Interestingly, there's very little about reflecting on the therapist's work and making sure they know what they're doing. Um, a good example, I bring up surgeons a lot because I think they're a really good example. There's lots of different types of surgery. I do not want a brain surgeon doing open heart surgery on me. Now, are they going to do a better job than the majority of every other human on the planet? Yeah, but they're also not heart surgeons. There's different types of surgery. There's different types of therapy. Um, Gosh, this little part of my mustache keeps coming down, and I can only see that when I'm doing this video. My goodness. Constant problem for me. I need to scissor up that area. Anyway, if you weren't distracted by that already, I apologize, because you might be now. Therapy is not surgery. You're not going to, in most cases, kill someone with your mistake. Interestingly, it happens very rarely, but less so in surgery. There's actually quite a few deaths from surgery every year. Still better than not having surgery as like an option. But there's not any real belief for most people that all therapists are made equal and that we all have the same ability. A trauma specialist is not the same as a child specialist. There are actually quite a few, and I'm specially trained to work with kids, so this is why I'm maybe a little bit more passionate about this. Um, there is absolutely a specialty to work with kids, especially young kids. Really, I've specialized training and working with kids under 5, pregnant families, moms, and everything in the early stages. Um, but everything for sure preteen and younger is not normal therapy. And when I hear people who start doing that with no training, I think that's, as far as I'm concerned, a violation of ethics and potentially illegal. Laws say that we're supposed to practice within our scope. Um, and yeah, the majority of therapists have no idea what they're doing with kids. The majority have no idea. They just apply what they learned about adults. And it's not entirely their fault. The universities don't really teach us how to work with kids. You're lucky if you get couples or family work, let alone kids specifically. It's just not common. But what I do blame them for is if they try to do work that they're not trained to do. And there really is a fine line with this of when does something overlap. And if you're not a trauma specialist, maybe you're just working with someone with maybe you keep it really casual for your therapy and you do a lot of phase of life stuff. And then the person has a really traumatic event that happens and you're their go-to person. Okay, well, now we have to ask the question, do you refer out? Well, they trust you and they want to like you're their person, but you're not trained to treat trauma. What do you do? To that, the answer that I do have is you continue seeing them, but you also refer them to a trauma specialist. And don't go past your limit. Keep doing regular therapy with them. Outside of your therapy, they need to do trauma focused therapy. And if you are deciding, hey, I don't want this to happen again, I want to get trained, then go get your training. And then going forward, you can treat it. But people really, I don't think, have a strong idea all the time of how widespread the field is. I think a lot of therapists understand that, but there are some that don't. They think they can just treat whatever, and it just isn't true. And I think most therapists can treat most things just fine. But to actually be good at your job, you really do need to specialize in what you're doing. And you can be a good generalist the same way that a general practitioner is a good generalist, but you're not an expert, and you won't ever be. You might be, I guess, unless you make an argument that you're an expert at like generalizing. That's fine argument, whatever. Um, but you're not gonna ever really have a focused thing that you do. So I do think it's good to focus in. And so, how does that connect with regulations? Do we regulate specialization and people saying that they can do something when they can't? I don't know how that would look in practice. And a lot of the things that we can talk about, it's like, this sounds nice, doesn't it? Less or more regulations. But implementing is a totally different thing. One example is I'll use specifically marriage and family therapy, which is my specific field and title. When you graduate, you have to take a national exam. National, meaning the country, the US. And once you take that exam, you're not nationally licensed. It's a nationally standardized exam. Everyone in the nation takes the same one. But your state decides your licensure. So you take a national exam, submit the scores to your state, they decide if it meets their standards, among other criteria potentially. Usually, if you get your degree in the state you want to practice, they're going to have it met already, but some people get a degree and then move to a different state to practice. And sometimes that new state has different expectations, different requirements, and you're not ready. It doesn't matter that you pass the national exam. So there's a lot of debate on should we have a more standardized, I forget the language, but also like a cross state treaties sort of thing where you can work in any state when you're licensed. I think there's pros and cons overall from my study, which is not extensive. I don't see the issue with cross state. Um, Now, where I do sympathize heavily is if one state just has higher criteria. They're like, hey, you really need to know X, Y, and Z to be like, we really believe that this is important. California is one of those states. So, marriage and family therapy really sprouted out of Palo Alto, California. And to this day, they're still pretty, what would you say, exclusive? They're a harder club to get into if you don't graduate from a California institute that trains marriage and family therapy. If I wanted to go get my license in California, I do think I would have to take more classes, not even just training. I'd have to go to school for a little bit longer. Um, and where's the line? Like, I'm a big proponent of high standards. especially for healthcare. It's people's lives. Anything that's dramatically affecting people's lives, quality is important. And I think a lot of fields really bring in people that aren't quality. And then you can broaden that out to how we encourage subsidies. So some people have argued, you know, this whole paying for people's college thing. Why aren't we doing that for jobs that are needed? Why aren't we why aren't we funding police departments, fire departments, hospitals, doctorates, therapists, teachers? Why aren't we paying them to go to school? Jobs that are kind of the backbone to societal structures, health and safety. Why aren't these the fields that we're paying people to go into? Or maybe not paying them, but we'll cover your schooling if you of course still pass the prerequisites to get in. And I think it's a great argument. We want more people to, and I'll use therapy for example. I think the biggest barrier to do my job is resources. It's we're trained a lot on cultural sensitivity and being aware of minorities and oppressed groups and social um, social structures and how society works. And all the while, it's just a room of people who can afford graduate level education, who can afford to go to class quite often. I guess the coursework's actually not. It's like 5 to 8 hours a week, but then you have a lot of homework and training, and then you have to do supervisions, and then you have to do uh, clinical internship, which is a job in itself. I mean, that's 20 plus hours a week. So a lot of these people, you have to be able to afford to do that, to take the loan out potentially, to pay your way through potentially. So we're taught to like, oh, how do we pay attention to socioeconomic status in different cultures, and then all the while it's being taught to a room that the only reason they're there is because of privileges that they have. And I think there's an argument that everyone says therapy is important. So do we pay to let people become therapists so they don't have to hold that burden? And then, of course, you get into the question of, well, then do you incentivize people who shouldn't be in this field to just get a degree in it because, the degree's free? So there's a lot of things to think about, different layers, but I think they're good conversations. Um, and frankly, I don't think a lot of people would do that because the majority of therapists don't get paid well to begin with, just like teachers. Nobody, I guess you have maybe some ignorance when you're young, like 18, you might, if someone said, hey, I'll pay for you to become a teacher, you might be like, great. But most people don't become a teacher because of simplicity, because they know when they get out, they're not going to make a lot. Yes, you can work your way up and make six figures in teaching. There are a lot of people actually that make six figures in teaching, but most of them are principals, superintendents. They've had to go on to get a master's. They've had to work pretty hard. So every field has its lucrative-esque nature to it. There's always a ladder to climb, but for your entry-level position, therapists, teachers, they make nothing more or less. I mean, it's pretty rare. It's pretty rare for a family to live off of, well, one income in general nowadays, but that's unheard of when a therapist or a teacher says they're the sole provider. It's just not really the world we live in. So do we incentivize that? And how do we hold regulations around a therapist doing their job? Because you could say, well, they have to submit footage of them doing therapy every year. But then do they kind of fake that footage because they know it's the footage? Is that invasive to clients? How do we do privacy? Because therapy is a one-on-one thing oftentimes. At least in other places, you can bring in people, and we can bring in interns. We can do co-therapy as well with licensed clinicians. But I think you can get the point that I'm going here. And this has the potential to go for way too long, so I'm going to pump the brakes a little bit. But the question really that I want to pay attention to, and I would love if you're listening to hear your thoughts in the comments. From what you know about therapy, whether you've been, whether you are a therapist, whether you don't know anything really about it except hearing me talk, do you feel like it's overregulated, underregulated? It's good. If you could change any of the regulations, what would they be? What would you add? What would you take away? I'd be really curious because I think it's a good and healthy conversation, and I think it should be talked about without aggression or malice. It's good to discuss. Essentially, the core of the question, I think, if asked from the right place, is how do we make this field better for everyone, the people working in it and the people receiving the treatment, and at some level, even the taxpayers and what's worth it for them to pay for. So, of which we all are in that category. So yeah, I'd be curious your thoughts. So, yeah, regulations and therapy. That's kind of my thoughts for today. See ya.